Hello, my name's Christina Makowiecka from the Ideas Project. We have a satellite session at the HSR conference, and I'm very pleased to introduce Katherine Semrau from the BetterBirth programme, one of our collaborating projects, who's going to talk about what she hopes to get out of our satellite session.
I think one of the best things about the Ideas Project is that it is bringing a standardized and systematic method to look at a variety of maternal and newborn health programs across 3 different geographies. Rarely in maternal and newborn health do we see systematic measurement or characterization of programs that are being implemented from the implementer's perspective. I think the great area that will be exciting to learn about at HSR is, first of all, what are the different innovations that are happening across these 3 different geographies? How are the process measures and outcomes being assessed? And being able to do direct comparison across the 3 different projects is of great excitement to me as someone who's focused on implementing innovations. I also think that the Ideas Project, because they've taken data from the field and made sure that data is being used actively in the field, looking at context-specific outcomes, context-specific innovations and interventions of what works and what doesn't and why, is going to be really interesting to learn about at HSR. As a public health researcher and implementation focused kind of researcher, I think one of the areas we've been very interested to understand is how do you actually scale up an innovation that looks to be a promising in terms of effective outcome in impacting maternal and newborn health. So not just how do you scale up, but how do you measure that the scale up is being effective, and how do you measure sustainability? And I know that Ideas has been focused on understanding what are the characteristics of a successful scale up, how is it consistently measured, and how do you think about bringing that innovation to a larger community. So I think we can learn a lot from the programs in Nigeria, Ethiopia, and Uttar Pradesh about what has been successful in terms of innovations that have been scaled and how to actually sustain the impact of the different programs. The BetterBirth program is based at Ariadne Labs, a joint center between Brigham and Women's Hospital and Harvard T.H. Chan School of Public Health in Boston, Massachusetts. The BetterBirth program is focused on bringing the WHO Safe Childbirth Checklist to settings that can help need improvement in maternal and newborn health outcomes. We are working on an implementation strategy around the WHO Safe Childbirth Checklist to try and introduce the checklist at facility-based delivery. And we're testing this strategy with several partners in Uttar Pradesh, India. In India, we're working with Population Services International, as well as the governments of UP, Governments of India, Community Empowerment Lab, and the JMNC College in Belgaum, southern part of India. The trial is focused in 120 facilities that provide labor and delivery services, and we're testing, does the WHO Safe Childbirth Checklist, along with a coaching-based program, reduce neonatal mortality as well as maternal mortality and maternal morbidity. We'll have results of our trial in early March 2017.